So now you have slept well, right? Let's do some hand rubbing again. Okay, so sleep talk is done. You have made some notes here. Hand rubbing. Just sit there and hand rub. Yeah, ready? Now. Let's take a deep breath in. Now, who amongst you uses the top half? Thoracic. So there are two types of breathing. One is abdominal breathing, which we hate because it will show our belly. So look, when a baby sleeps, you see, they go like this. That's the best breathing. It's called abdominal breathing or lateral breathing. You can take maximum suck in here. So when you breathe in, you should like this. And when you breathe out, but we have lost this ability to do that. So we breathe like this. It's called vertical breathing or thoracic. If I ask you to take a deep breath, everybody does this, isn't it? Yeah? So we basically try to control, but nobody does. Nobody. And that's the diaphragm and that's why we get pneumonias. Particularly in the hospital, you're lying in a bed, your diaphragm is hardly moving. Most of your breathing is, yeah? So let's take some diaphragmatic breath, yeah? Put your hand out like this, yeah? Or on your thigh if you want to rest your hand, yeah? And now, blow your tummy when you take breathing. I would say breathing in. Breathe in. Out and squeeze your tummy out. In, out, out, out. In through your nose, out through your mouth. And when you do the out, look at me. When you do the out, blow a candle. Blow candle at the same time, suck your tummy in. Okay, blow on your tummy and see your tummy gets in. When you breathe in through your nose, see your tummy, look at your tummy. Your tummy should bulge when you breathe in. And then, yeah, one more. Breathe in through your nose, looking at your tummy, make sure your tummy bulges, and when you breathe out, blow air on your tummy, make sure your tummy sucks in. And see if you can make the power of the breathing. Almost passing out. You know, the more you pass out, the better you just exhaust your lung. And then, with a cigarette. Who has ever smoked a cigarette? Okay. Who smoked cigarette at least for 1 month? Who's still smoking? Do you know, compared to all other addictions, cigarette smoking is very unique? Because all other addiction will have some health problem, some withdrawal problem, yeah? Like particularly hard drugs, etc., alcohol. But cigarette, people start eating. Do you know why? When they stop smoking, they start eating, yeah? Think, I'm a smoker, imagine, yeah? I'm not, okay. I'm very tired, I had a really bad argument, okay. The reflex is, okay, where's my, okay. So you light up a cigarette, yeah? You're doing it absolutely, you don't have to think about it, just letting. You're taking it, okay? Feels so good. Do you know what is the good thing? The breathing out is the good thing. So you're thinking this is making you relax. It's not. It will relax anybody, right? So there is a torture camp for the smokers who want to give up. So they have voluntarily signed for it. So they go to a chamber when they want to smoke. It's provided by the office or hospital, not in our hospital. You go there, you take your cigarette here, stop. There's an automatic voice, stop. Look at your cigarette. You have to look at your cigarette for 1 minute. For no good reason, okay? Smell it. You smell it? Okay, I'm liking it more or maybe what this, okay? Then take your matchbox or lighter out, okay? Wait, look at the lighter. 1 minute. Okay, light it now. Look at the flame. So do you know what I'm doing? I'm breaking your automatic habit into a conscious habit. So you're doing that. So you're actually not needing the cigarette, you are needing this routine. Yeah? See, I'm breaking it. Look at the lighter. Look at the flame. Okay, now, light up the cigarette. Wait, hold. Don't smoke. Look at the cigarette. It's now lighted. waiting for you. But don't. 2 minutes. Look at the cigarette. Put it in your mouth. But do not smoke. Just let it be there. Stop. Think. What I'm breathing? Dirty air. No, maybe you're not feeling that, but just feel it. What are you breathing? Just try to explain what is actually this taste like. And just this simple intervention, apparently 40% of the smoker reduced, 10% completely given smoking up. So they are saying that rather than telling a person do not smoke, just do this torture chamber. So torture them when they are smoking. Not you are torturing, you are stopping, many stops in an automatic behavior which you don't want to do. So your conscious brain is telling, I don't want to smoke because I'm getting COPD, LRTI every week, every month. I'm now huffing and puffing. I'm 50, I cannot climb a stair, I cannot run with my son. I want to stop, but you cannot stop. How can you stop? Because your subconscious is huge. And that has programmed your body and mind and brain that you are stressed and relaxed. And your conscious brain is this small baby. When the urge comes, you're powerless. You will have to smoke. Okay? So, but there are tricks how you can feed that information into your subconscious so that you don't have to even struggle to kill it with your willpower. Willpower is a bad idea. It's a bad investment. Because willpower, 1 day, 2 days, 3 days, 4th day, you're smoking again. So you need to get the message into the subconscious. And how do you do that? Any idea how do you get a message into subconscious? Anybody? I know there are some veterans. We all research a lot about subconscious, don't we? Because superconscious, subconscious, 95% of what you do is all driven. Whoever chosen coffee outside, tea outside, you haven't chosen it. You are not conscious because you always drank coffee. Why choose tea? Right? You always sat with your partner or because, a house full of strangers. But what I do, I try not to sit with people I know. I'll find out something. I went to a workshop and I found the eldest person in the room. She's 86 and she's a retired nurse. So I kind of just so much information. And if you spend half an hour with me, I will know everything about you. And he will probably know nothing about you. Because I'm a listener. Because if I tell you something, I only love to tell here. If I tell you something, I don't know you. But if I allow you to talk, I know you. And then I can connect on a different level. Yeah? And that's the thing is missing in the NHS. Because a doctor talks, instructs. We doctors, we never inspire. We just tell you, don't smoke, don't do this, lose weight, do that. But we don't teach you how to. We don't even teach you what is the mechanics of how to stop smoking, how to lose fat, and then the mind side of it, how to do it. One is that knowledge is a problem because we are doing all the wrong stuff about fat loss. Oh, is stress killing me? Okay, good topic, because Josh told me, Dr. Ghosh, I don't want to lose fat, I'm already not fat. And I don't want to do this. I want to know stress, how to exam stress. Solid stress. It's a good stress. I always use the stress of exam to drive me more. So what is stress? Does anybody know what is stress? Too stress. Stress means a lot of work, small time, isn't it? And we talk about stress and immediately this is time management. Oh, you need to better manage your time because time is 24 hours for Bill Gates and for you, Steve Jobs. But they are doing so many stuff and we are doing only nothing almost. So you've got so much stuff to do and little time. So two things has to happen. So time management is a concept, is going out of the window. Another concept is attention management. So you cannot manage time, can we? So we can only manage our attention. In the 24 hours, I can put my attention to Netflix all day. Or put some structure into my routine. Okay, I will do Netflix, but it is when I want to do Netflix. And schedule a time, okay, 6 o'clock is my Netflix time. No matter what, I will watch Netflix. And the reason I'm talking about Netflix is so addictive. So in December, January, I didn't have much work to do other than routine work. 200 movies I watched. 200. And I saw a series, the episodes, one after another, no food, no nothing. Yeah, that's my brain life. Because it's fascinating. It just grabs your attention with the emotion and everything. So the media companies, the Facebook, WhatsApp, they are all attention seeker. They are selling your attention to the companies. They know that you are Googling projector, so you will only see projector ad, right? So they are the attention, they know the attention and they sell the attention. And attention is such an important thing. So your stress will never go unless you know where your attention is. Because if you allow your attention to get distracted into 1,000 directions, you feel you're enjoying, but actually your brain is getting so fed up with you. So in your day, plan some white space, nothing. I will do nothing. Because many centuries ago, Pascal said that the problem of the human race, and it was then, with no WhatsApp, no Facebook, the problem of the human race is that we cannot sit still. If I ask my son, he will go crazy with the mobile phone, with the laptop, just sit, do nothing. What do you mean? I have to do something. No, do nothing. Just sit. Because only when you sit, then you think. And only when you think, you discover. You discover, oh, and then all the subconscious will come to your conscious. So we have to plan some thinking time, sit time, I call meditation time, that not only de-stress you, you will see the whole big picture. Because when you're watching football, like players playing, they are paid millions. They say, oh, stupid footballer, you pass, you can't see, everybody shouting. He can't see. How can he see? Because he's in the battlefield. He has lost the perspective. You, the coach, see what's going on. So coach is telling, you go there, because coach is seeing the entire picture. So in our life, we are not seeing the entire picture. Because we are in the washing machine, continuously. But if you are practicing stressless life, then you are outside the washing machine. You're saying, that's my yesterday. I acted crazy yesterday. Okay, what happened there? Oh, that guy told me that. Oh, I forgot it. So you are seeing the whole you outside you. Does it make sense? Yeah, so that's a mirror now. So you stepped out of your body or mind and you're watching you. And they will say, oh, that was a very uncool thing to wear a headphone when it is actually not working. Yeah? So you analyze yourself. But the problem is, you have to be very neutral. Sometimes we are the worst critic of us. In my head, oh, I'm ugly, oh, I'm fat, oh, I'm this, I'm that. And there are studies after studies showing that, suppose you got a regime, like, okay, this is my promise. 1st January, I'm not going to do this, I'm not going to do this, I'm not going to do this, not smoking. You are like you've been running marathons in 6 months, you've done all that. But what is your baseline? Your baseline is that you've never even done a single morning walk and you're thinking of marathon, right? So yes, a lot of energy with the motivation on 1st of January, because goal setting, the moment you set goals, you feel full of energy. But that energy is coming in the conscious mind. The monkey is not buying. Monkey said, you never done this. You never done this. So there is a disharmony between monkey and the sage. Or the sage and the teenager. He called some doesn't like why you are bothering monkey. Monkey is a very good animal. So this is the who told it in the workshop, like why you don't like monkey? So call it teenager. Your teenager is an iceberg, full of energy, a lot of power, a lot of passion, a lot of emotion. And sage is like, okay, what's for me? Okay, I know that cookie looks good, but I already had one. I will stop. Teenager, one more. No, let's see, what's your big plan. So this is it. So if you are in like a goldfish or fish in the aquarium, they are in the water, so they don't see the water separate. So we are in the stress. So you don't see the stress, but the moment you sit, just sit with no agenda. Like I'll be sitting for 5 minutes. The time will look like eternity. So let's all sit. Close your eyes. Okay, just draw your knees. Put your hand like palm facing up, just on your on the table or on the lap, whatever. Yeah. Now you're going to close your eyes. and just feel the noise. You haven't even aware of this noise that you can hear now. Noise of all the electronic equipments, projector. Can you hear? Yeah, we can. Now, feel your feet. Is your feet on the ground or you're kind of half ground, half? So plant your feet fully on the ground if you can. Yeah. Some of the chairs are maybe too high, too low. So plant your feet. Yeah. Now make your spine neutral. So don't twist your head onto one side. Make your look forward. Look forward. Yeah. Just make neutral. Okay. And now, with eyes closed, look slightly up, as if you are looking at your forehead. Slightly, very so slightly. Have a seat. So, just have a seat, close your eyes, palm up, relax. Just focus on the breathing and the noise. You will be hearing your own breathing. You will fill your nostrils with air. Not even 30 seconds gone. And now focus on your breathing. Now remember that breathing. Deep breathing with your nose. When you breathe out, blow candle and suck your tummy. Make noise. And now quiet breathing. Do the same but quiet. Now gently open your eyes. Gently open your eyes. Yeah? Now, do you feel a little bit relaxed? A little bit? Tiny bit? You have to. You have to. Because the sleep, what is sleep? Sleep is shutting down all the senses, yeah? You shut your eyes, shut your ear, shut your temperature, shut everything. So this is what you have just done. You have shut down a few closed circuits. Why we feel stress? Because there is a lot of open loops in our brain. Not in the conscious brain. Maybe in the conscious brain you're thinking about the workshop, then I have to go to the church or go to the groceries and this and that. That's conscious. But the subconscious, there's at least 50 things bothering you. 50 things bothering you. And when you do that, you're switching all the programs on the laptop, so that your laptop becomes much faster. So the stress is one, becoming aware that we are stressed, that we all know, and then finding the stress in the mind and stress in the body. And at least, rather than smoking a cigarette or going for a coffee, etc., I plan some sit down time every day, like at least 3 times. I'll just go to the toilet sometime. People might think I've got IBS, but I'm actually just in the toilet, sitting on the pan and just thinking. Just 5 minutes, that's all you need. 5 minutes, no WhatsApp, no checking your mobile phone, yeah? Just 5 minutes. Because this constant need to check the phone, we are slave to our phone, yeah? Nobody will die if you don't check your phone for just 5 minutes, yeah? And the other habit I wanted to do, I started doing and I felt I'm still struggling, that I will only WhatsApp at hours, like 9 o'clock, 10 o'clock. I will only check at 9, 10. It's a new thing I know today. So I'm just because of me, there's a curfew in the hospital that nobody posts anything on WhatsApp after 8 o'clock. Because when the brainstorm comes to a creative mind, you know what happens. I said, Dave, why can't you just post one big post? Why post ding, 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 ding? And if you're in a meeting, it is so embarrassing, isn't it? Because people put their notification on, and I don't, so I don't realize what is happening to their professional life. So I got told of by a consultant in royalty, Dave, I'm in a meeting. Just tell me once what you want to tell. And I'm trying to sort out another patient with a swollen hand. I said, what's going on? Ping, 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 ping. So, unless you can't talk about meditation and all that stuff and then immediately go to, so you will probably over the next few weeks and months progressively see a decline in my rate of posting. It should all be concentrated posting, like phased posting rather than ping, 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 ping. Yes, the ideas will come bing, 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 but list them, archive them, and post them in certain time. And this is something, I'm now 52 years old this year, for a brain which is like I diagnosed myself with ADHD. I cannot sit still. It's a huge thing to do, to sit still. I'm always looking for what next, what next, what next. Nothing next. Just stop. Yeah. So stress means too much stuff to do. So first shrink your stuff. You don't have to do too much stuff. So a lot of fluff, cut out, cut out, cut out, cut out. So one, you have reduced your, and that fluff you can only see when you take a long perspective. So get out of your body, get out of your life, look at you. What are you trying to do? And you will see, have you heard of Pareto principle, 80-20 rule? That 20% of your profit, 80% of your profit comes from 20% of your products you sell. So focus on those products. So if I'm a very good doctor, I'm not a very good rock climber or a marathon runner, so I will run for fun, but that's not my main thing. I'm very good in talking and trying to inspire my patients and trying to help them with their health problems. So that's what I should focus on most of the time. For variety, I will do this and that. But if I want to play cricket, I want to do everything. I want to do scuba diving, I want to play cricket, I want to play football, and that's the problem. I get interested in anything and everything. And if you tell me, Deb, let's go fishing, let's go fishing. Tomorrow you ask me, do this, okay, let's do it. And then now, because I'm doing meditation, I'm realizing what I'm doing. Because my energy store is only this much, and I've got only 24 hours. So I need to, what do you call it? You need to rein your horse, isn't it? Yeah. So stress means squeezing your workload. Obviously, if something is mandatory, you have to do, like appraisal. I got another reminder from Andy Morris. This is the 5th year in a row, Deb. You have crossed your deadline, so I'm going to stop your salary. So I promise this weekend. And guess what I have done this weekend? I went to a conference to hear Gita yesterday. Then pub quiz night last night. Then thinking about the workshop. Now I'm in the workshop. So when I go home, from then I have to finish all my appraisal. And apparently I have to get a 35 patients feedback, like how good or bad I am, both of my strong, strength, etc. And I forgot to bring that paper. I thought, it's very easy. I'll have some at least 20 people here. I'll just give. I forgot the pack anyway. Long story, and you will forgive me. But so I don't get enjoyment in appraisal. And some of my colleagues, they are so good. Every week, every day, because for them the appraisal is a huge thing. But I appraise myself. Am I getting better? And I read probably the maximum in the department. I go to maximum conference. Judy, she's the manager of education center. I'm very passionate. I think I'm more passionate about the medical students. I read every day. It doesn't matter which part of the body. Prostate. And I said, take videos. And I sent the other day, Simon, his hand surgery. Dave, why you send me so many hand videos? Look like he had a hidden passion in hand surgery. Why didn't you become a hand surgeon? He doesn't know. I sent similar videos to urologist, to the psychiatrist, to the neurologist. Like last night I posting Sharmini, our neuroconsultant. Sharmini, what is the periaqueductal gray matter? What is its function? I said, interesting. Why are you asking? Because that's the center that controls your immune system. And how do I know? Because the Iceman, the Dutch Iceman called Wim Hof, he climbed Mount Everest base camp naked, just a short and a shoes. So he can control his body temperature. And the reason I survived 15 minutes in the ice bath is because of him. Because he taught me how we can do that, how we can not die from hypothermia in ice. So it's not ice bucket, not like 1 second the ice on your head. It's ice, you are submerged in the ice. Have you ever done that?
Yes.
Good.
I had an injury.
Injury?
Yeah.
And fallen into a river or something, or a pond? Or?
Well, my husband, he was a rugby player, so he told me to sit in the bath with ice, and it helped my knee.
So if you haven't tried, if you have a musculoskeletal problem, like a joint pain or hip pain, within weeks you will see benefit. Okay, so now
I only did it twice though.
Only twice. Yeah, but what I would recommend, not just cold, hot and cold. You need to jog your immune system, both sides, not one, so that you can stay in the center. So every day, your shower is your hot and cold check. So now we know that shrink the stress, do meditation, and we complicated meditation. Just this simple thing, just sit. but the noise will come when you're home. It will not be as quiet. My kids will be shouting, TV, etc. So this headphone that I always put on, this is noise cancellation. But if you cannot find that, just put a normal, the cheap headphone, like a 7 pound, 10 pound. But play a bit called binaural beats. I will share it in the WhatsApp group. It's binaural beats. It changes your brain frequency and push it more to the to the theta. So now you're agitated, but if you start listening, although you're not thinking, your brain is listening to the music and your brain is pushing it to the alpha and to theta. And if you're really focusing, it will make you sleep. That I haven't mentioned about the effect of noise on sleep. Total silence sometimes is not good for sleep, because our ancestors never slept in total silence. Total silence is bad news for them. Do you know what? Total silence means a predator is approaching. Because normally there is noise, crickets, chirping, etc. Even if it's forest night, but the moment it is silent, some leopard, some tiger is approaching. So total silence is not good. So a little bit of white noise you can play on the background. Yeah, that will make you fall asleep. So that's stress. Stress is such a huge thing. I can talk all day. But the strategy-wise, number one, the biggest strategy is meditation. But the problem is that you cannot meditate first thing in the morning or last thing and then do really you shout at people. You cut across, you drive, you overtake people. You fight for your rights. This is my right. So you cannot be combative, fight for your rights. And all this comes from insecurity. If you're very confident, you don't fight for your rights. You just let them, what the big deal? Unless it's really something hurting you. Yeah, let them pass. 1 minute, they will go. So your practice of mindfulness should be all day, not just when you're doing meditation. It doesn't work. But try at least meditation. Yeah. And the other thing I've seen from meditation, it actually it's like a coffee for me. So when I'm really, I've got a lot of brain work. My brain is like fried. I'll just sit down 5 minutes, and sometimes I can even go to deep trance in that 5 minutes, literally. And when I wake up that 5 minutes, I'm fine. And there's a concept called nappuccino. Have you heard of nappuccino?
5 minutes.
Yeah, 5 minutes. So basically, nappuccino is something you take coffee. Yeah, that coffee, the caffeine, takes 20 minutes to hit your blood vessel. So you take the coffee and immediately get this kind of just, no need for sleeping, just that. And then when you, and it has to be less than 20 minutes. More than 20 minutes, that's bad for you. You're going to the back state. So I normally set my timer at 15 minutes. So 15 minutes, and people thinking, what's happening in the toilet? So don't tell anybody else. People haven't discovered this yet. And so just go to a place, put your headphone on, and just, as you have got right in your work to do lunch and tea break and coffee break, this is your right. And I can't tell you how much more energy you will get throughout the day. Unbelievable. And this is called nappuccino. So you take a caffeine, then you do a 15 minutes. So by the time the 15 minutes is over, you've got the caffeine, you have got a clean brain, and you're ready to go. Yeah. I will try to put some videos on the group, like good videos. Walk every day, even if it's 1 minute. Walk every day, or if you want to think, you're thinking about a little bit more than walking, because you might think walking we are doing every day. What's the new thing? So do something called speed walk. Yeah, speed walk is basically walk, but you walk a bit. So your normal walk is like this. My wife's walk is like even probably slower. We always start together, then suddenly say, "Where is she? Oh, she's there." Then I wait. So this is our normal walk. So we all have got our normal pace. Yeah. So my normal pace is like this. So that will probably be fast walking for my wife. Yeah, so my fast walk will be almost running. So my speed walk will be like this. So I'm not asking you to walk like that. People will think, what's happening? So rather than that, just do something called, there's a video in internet, quite famous, Chinese old gentleman, just doing this. It's kind of speed-wise, it is probably walking speed, isn't it? Yeah? This is probably slower than my walking speed, but what it is doing, it is giving your body some gentle vibration. So for osteoporosis, for weak bones, for weak joint, anybody with a joint problem, if I do a bone scan, you will see that your bones are quite black, meaning not enough calcium. And to have calcium, not only you need exercise, you need this vibration thing. So swimming doesn't improve that much where this running does, because you're doing this vibration. And I'm going to invite a guest speaker soon. I met her, she's now I think 70, and she started taking up jogging. She done a London marathon when she was 60, so 60 to 70, so she has got 10 years. And she was told that you've got osteoporosis, you have to take this medicine for the rest of your life. Fosamax. Anybody take Fosamax here? For joint osteoporosis? Nobody has got a diagnosis of osteoporosis here. Okay, good. Good to hear that. So this Fosamax and calcium. The other option is sunshine, which is not there. And I'll give you some alternative, but this here. So you basically, just a little, it's also relaxing, yeah? But people will not think you're funny. I mean, you know, just this, yeah? Who has actually is doing regular jogging, running, walking, regular? When I say regular, I mean weekly. Okay. So walking, everybody is walking, right? Everybody. We walk. So that walking, just being a little bit of spring into that, that's good enough, yeah? And then if you can run, even better. So I kind of injured my feet trying to do a London to Brighton walk. So I managed to walk only 71 kilometers. It is total 100 kilometers. But we are doing again. So in life, with the health, you need to set up little challenge. Because of that walk, I'm thinking of doing something regularly. If there is no London marathon, if there is no challenge, you will not feel that motivated. So make a small group and make a challenge that, okay, I'm going to do a 5K. I'm just going to walk 5K. Okay, I'm going to walk 2K if you've got joint problem. What will happen? This exercise is a keystone habit, because the moment you start exercising, the moment you will also improve your eating habit. So thinking something more abstract, like, oh, I want to lose fat. That's abstract, good. But think about how you do it. So exercise. So you have to do aerobics or cardiovascular, which is running, swimming, etc. The other is stretching or joints. And the third thing is strength, like lifting. And all of us are losing our muscles. After age of 30, the testosterone hormone, etc. goes down. So the basic thing is upper body, lower body. For the lower body, you have to do just sit down and stand up. That's all you have to do. That's the basic minimum, yeah? And see if you can do this. Yeah, that's very good. But maybe some of you will not be able to do it. Like completely sit like this, yeah? And stand up and sit and see if you can stay there, yeah? Because you don't have to go to gym. All you have to do is sit down, but you can nose to. Rather than that, this is better. And stand up. If you do that like 10 times, that's your enough lower body, yeah? Yeah? And then do on your, yeah, that's enough, yeah? 10, 10, 10, 30. And upper body, just lift up something like a chair or something, or a bag of sack, and just this, yeah? Minimum. So you're keeping your upper body okay, lower body okay. So that's your muscle. Your is speed walking and stretching. Now let's do stretching. Okay, so first you're eating neck, side to side. And then front to back. And then a little bit rotation like this. Whatever you feel better. I do a whole, but some may feel easy doing that. Okay, now the shoulder. Just shrug. And see if you can rotate while shrugging one direction and then the other direction. Don't stretch too much beyond your comfort zone. You may get a cramp, okay? And then just as if you're lifting a barbell. Yeah. And then the reverse grip. Change your grip. Yeah. Now do this. And move up if you can. Okay. Sideways if you can. Slap other people next to you. Okay. Now one arm. Reverse. The other arm. One direction. And then reverse. Now interesting, the most important joint in the body is spine, because all the nerves are coming through the spine. So twist, little bit twist, little bit. And see if you can hold. Can you? And then go to the other direction and hold. And back again and hold. Okay, now Next is bucket, as if you're picking up a bucket, another bucket, bucket, bucket. But keep your, no. Your spine must not do that. It must be straight and like this. Okay, do it. Put your hand in your thigh and just slide your hand up to me. Slide your hand up to me. Yeah? Slide. Slide. Now feel the tension. Don't jerk, but just stretch. Feel the stretch, hold. And then come up. Other way, feel the stretch. Don't do too much and hold. Yeah? Again. The next thing is very important, which is can bend. So if you haven't done this before, just slide again. Use your hand to support your spine. And slide, don't stretch, no show off. If you can touch your feet. And if you can touch the ground. Yeah? And then stand up. And put your hand on the waist. Yeah? And now rotate like this. Little bit, not too much. Yeah? Little bit. But try to keep the head straight. Head should not be like this. Head is like this. And it's like a belly does. Yeah? It improves the flexibility of your hip joint. Yeah? Or if you can just, without hand, you can just do this one, right? Yeah? Look at that. No, show you off. Okay, so that's it. Next, back. This is difficult, but see how much you can do. Little bit enough. More if you can. Don't shock. Come back. And reverse movement. Again. Gently. Everything, no jerk, no speed. And up. So the rule is you have to do 5 each. Yeah? 5 back, 5 this, 5 that, 5 that. Minimum 10 is even better. And next joint is knee. Very important. Anybody knee arthritis? Yes? A lot of hands. So be careful. So if you have a knee arthritis, I'm sure you cannot do what I'm doing. Yeah? Can you do anybody with knee arthritis? Okay, who can sit like I'm sitting? Okay, 1, 2, 3, 4, without pain, yeah? You are sitting without pain, you guys? Yeah? So quite a few yeah. So you will realize, because in Eastern countries, in India, Pakistan, there is no chair. So if there is any meeting in the village, in the city is posh. But in the village, we all sit like that. And this is so good. This is good for your flexibility, joint and everything. Good for constipation as well. Because there is a new potty called squatty potty. Anybody with squatty potty. Has anybody not heard about squatty potty? So anybody who has got outlet block, that means they want to go to the toilet, but they feel that it is there, but it's not coming out. Squatty potty is basically, you sit your normal commode, but there is a stool. It's basically a stool that goes, your leg goes up like as if you're squatting. Yeah? What happens the moment you do that, the rectum is a bendy structure. There is a muscle called puborectal which slings the rectum up as if it is shut down. The moment you do that, it relaxes. So your rectum becomes straight, so potty poop can just drop. But if you sit like that, that's not the good way because it's blocking it. The moment you do that, now the opening is open. The stool can, if you push, I'm not pushing. It will just come. Yeah? So this is squatty potty. So in India, constipation is so rare. In the past, now every house has got normal and everybody is constipated. Because this is not natural for humans to do this kind of, also childbirth. Childbirth, the way we do childbirth, that's also unnatural. That's not how nature intended child to come out. Anyway, child is supposed to come out when mother is like this, and child will come out by gravity. So a lot of things in ancient tribes, which were more health, without knowing the actual health and dynamics, they were doing correct, and we become civilized and we did it wrong, and now we are going back to some of the thing. That the other thing in Crohn's, somebody mentioned Crohn's, and Chris wanted to know about Crohn's. Crohn's is almost unheard of in India. Do you know why? And do you know one of the treatment of Crohn's is swallowing parasite? Do you know that? No. Yes, it's in scientific paper. So basically our abdomen, our intestine becomes so sterile because everything is sterile here. We wash our hands. So you are not giving intestinal germ. So they don't know about the germ. So the moment a germ comes, it goes crazy. What is this? And they mount a disproportionate immune response. Okay, let me give an example. So if you practice meditation, you don't practice meditation. I tell you something offensive, I tell you something offensive, what you will do? You will be mirroring me. I'm shouting, you're shouting, I'm saying you're crazy, you are crazy. But she thinks, okay, is this guy mad? Should I better gradually walk up? So she's thinking using the slow thinking or safe thinking. But you are doing teenager reaction mirror, yeah? So similarly, the intestine, my intestine, if it's it's like a teenager. Oh, some bacteria come, let's fight the bacteria. She said, wait a minute, do you really have to fight this bacteria? So the same thing happens with Crohn's. Something happens, nobody knows what, it triggers an immune response, it starts to destroy the bacteria, but then it doesn't stop. It carries on, the bacteria is gone. So somebody told you something, the man is gone, but in your brain you're still poisoning. Why he told me that? So the original problem is gone, but you are incubating the problem in your brain and getting more and more poison in your brain. Same with Crohn's. So what is Crohn's? It's dysimmunogenesis. So your own immune system did not learn when to stop. So the standard story is like that, oh, I had a food poisoning when I was Thailand. Good, as if everybody will have a food poisoning in Thailand or China or whatever. My tummy's never been normal since then. Has anybody heard this story? Yeah? So most of the IBSs, something happens, before that everything was perfect. Something happens, a terrible infection, and it is not same anymore. And if you do stool test, I'm digressing a bit, if you do stool test, I can show that the stool of a healthy person who doesn't have any problem in their body, food, and the other person with IBS or diabetes, the bacteria is not the same, completely different. This is like a tropical forest, thousands of bacteria. This is only 4 or 5, Clostridium difficile CD. So we need to change that bacteria to this bacteria. But what I'm trying to say is that we should not be this sterile. Nature did not make us to be so sterile. Nature did not make us to sit in a room with a temperature control and go out in a temperature control car and then go out in a temperature control whatever, leave, and then catch cold or one catching cold. Because your body has forgotten how to adapt to cold. Because the virus is already sitting in my nose. It is just waiting for the opportunity. So when you go out to cold, what happens? Is your blood vessels shrink to preserve heat. The moment the blood vessels shrink, the natural killer cells and the immunological cells will stop going there. Time, let's get in. And you will probably realize, you have probably experienced when you go out to the cold, you feel cold, etc. The moment you come back, your nose will start watering. Have you seen? Your nose will start. What is happening? Because outside is vasoconstriction, blood vessels tight. The moment you come in, that's the time the virus will get in you. Because they are waiting, because of the ischemia, because of the narrowing, the lymphocyte, natural killer cells, they temporarily haven't been there, suddenly you open up the floodgate, boom, you catch cold. And that's why we catch cold when season changes. We don't catch cold when season is constant. So our body has lost the adaptability to change to cold and hot. And that's why I'm encouraging every day when you take shower, don't stick to a uniform shower temperature. Change it to hot and finish up with cold in the morning. And at night time, you should finish up with hot because you want to sleep. Because cold wakes us up, hot makes us sleep. Yeah? So that's immune system. So that's Crohn's. So you start an insult and you are still thinking about that man who shouted at you. Same, the bacteria has gone, but my body hasn't stopped. Fight. What can I kill? What can I kill? Kill my own intestine. That's what ulcerative colitis. That's what psoriasis. That's what rheumatoid arthritis. So if you want to improve, and in this workshop we don't talk about tablets, right? Because that's hospital. You go there, talk about all the biologic treatment, arthritis treatment. Here we talk about natural healing. Yeah, how our own body can heal. And that's hot and cold. Yeah, I think some of the question answer session they said, how can I improve my arthritis with that medication? So that's how you can improve. And the second thing you can improve your arthritis, just for a month, or even for a week, go to a vegan diet. But with a catch. Very few carbs. So go to a plant-based diet just for a week, just for 2 weeks to see. I think 1 week may be too soon, but 2 weeks, if you suffer from arthritis, joint pain, etc., particularly if it's inflammatory. If it's osteoarthritis, that might not help, but still try. But definitely if it's rheumatoid arthritis, or psoriatic arthritis, any inflammatory arthritis, and if you go to plant-based diet with less carbohydrate, it will improve. Plus take the hot bath and cold bath. Yeah, try these two, simple stuff. Yeah, and there's some other stuff I can cover because each topic I'm touching is a huge area, and I'll be doing disservice if I just casually say this. So let's focus. Now sit down, a kind of stretch. Oh, no, one more stretch. As much as you can. Yeah, like this, and then back. If you can touch something, get your balance, and do this. Yeah, and finally. Like this, yeah? And if you can, when you go home, just put your feet on that bed or chair and just stretch. What happens? This prevents injury. Yeah, sit down, please. It prevents injury. It makes all your joints supple. And what it also does, because I got a diagnosis in January of frozen shoulder. I could hardly lift my hand up to this point, only this, yeah? And I'm quite proud of myself being very active and doing this. And then I'm just this and just this. So I had an MRI scan. So it's proven. It's not like I'm bluffing. It's proven. This MRI. I saw the MRI shoulder expert, my friend. She told me, Deb, you can try physio, but if you don't quickly go to treatment, you're doing damage to your shoulder because the statistics say that this takes 1 year to heal. 1 year. Frozen shoulder. That's standard. I'm not making it up, yeah? So the treatment is put a needle in and inject water with pressure. Extremely painful. I said, will I get some sedation? No, we don't give sedation because we want you to suffer, you know. So I said, no. I'm a very painful person, so I don't want that. So, and now see. No medicine. And see, I'm even better than I was before. And this extremely painful. No, this is my good hand. This and now, see how much. Without any medicine, without any shoulder dilatation, without any dilatation and anesthesia. How? Our body has got tremendous power to heal without any medicine. But we don't talk about that because there's no money.
So how did you do it?
Yoga.
Oh, really?
And what is yoga? Stretching. I don't want to make things complicated. You don't have to do yoga. All I have done when I was meditating, rather than meditating like this, I was meditating like this. And gradually I'm pushing. So I change everything. I don't believe in any rules. Bend every single rule that I can. But be in the legal system. Yeah? So don't walk on the grass. I'll secretly go and just rub my feet on the grass. It feels so good. Because rules are meant for a reason. I love plants. So I'm not going to destroy a beautiful lawn. But I just love this feeling of walking barefoot on a lawn. You know, if you haven't done it, you should. So I just did that. And you have to focus your mind. I have to prove that person wrong. That doctor told me I'll need this. I'm a doctor. I know why she told me. It is fact. But I'm not that other random 100 person. I'm a super person. And I have got the benefit of knowing the medicine, Western medicine, and I know the benefit of Eastern medicine. Because in poor countries, there is not money. You have to know how to heal. And there is a book called Barefoot Doctor. You know, where there is no doctor, something like that. So you have to know natural remedies like turmeric. Yeah? But you speak about turmeric, any other doctor, they say, turmeric? What are you talking about? They don't know anything about turmeric. So I'm a gastroenterologist, yeah? But I can guarantee very few gastroenterologists in the whole United Kingdom knows how to cook properly. And once you become part of my group, you will see lots of cooking video almost on a regular basis. Unless you know how to shop for food, which food to pick when you go to Tesco, how to store the food, how to cook the food, how to eat the food, you cannot cure your ailments. So Hippocrates, we all take Hippocratic oath. He told many, many years ago, centuries, that let food be thy medicine. Let food be thy medicine. But there is no money in food medicine, so there is no drug company sponsoring. So all the stuff that I'm telling is ancient knowledge, but I cannot prove. If you look for evidence, my colleagues probably will ask for evidence. But you just look at the doctor who is preaching you, do this, do that. How healthy that doctor looks like? What is his track record, her track record? As I said, I have got 27 years of experience of practicing medicine. And one of my patients recently told me, so that means you started he thought I had 35 or something. So I said, this is unbelievable. I'm 52. Really? So you have to look at the person preaching you. Does he look healthy? Does he look full of energy? Can you see compassion in his eyes? Is he looking at your eyes and talking to you? Or he just kind of instructing you, this is what you do with liver cirrhosis? Yeah, but only, I've seen people giving bad news in such a discompassionate, say, you've got liver cancer. Obviously, the next question is, how bad is it? It's too bad. Stage 4. Okay, stage 4, how long am I going to live? Book says 6 months. So that bad it can get. I've seen this. The way people have, I've seen my consultant doing this as a junior doctor. There's no love. Unbelievable. How can you heal?